Welcome back to Diagnosis U, where we break down complex conditions into clear, understandable information. Today we're talking about a rare genetic disorder, Apert Syndrome. Understanding Apert Syndrome. Apert Syndrome is a rare genetic disorder that affects the shape of the head, face, hands, and feet. It's caused by mutations in the FGFR2 gene, a gene that plays a crucial role in bone development during early growth. Signs and symptoms. The hallmark signs of Apert syndrome are apparent early, even at birth. Craniosynostosis. This means the bones in the skull fuse too early, causing an abnormally shaped head and increased pressure on the brain. Facial differences. Children often have a sunken midface, widely spaced eyes, and underdeveloped upper jaw. Syndactyly. Fingers and toes are fused together, often referred to as webbed or mitten-like hands and feet. Hearing loss, dental problems, and vision issues may also develop. Some individuals may have developmental delays or learning challenges, though many have normal intelligence with proper support. Early detection and diagnosis. Apert syndrome can often be detected before birth through advanced ultrasound or genetic testing, especially if there's a known family history. After birth, the diagnosis is typically confirmed through a physical exam and genetic testing. If you notice any unusual skull shape or fused fingers or toes in your newborn, early evaluation is key. The sooner we detect it, the better the outcomes. Specialists involved. Managing Apert syndrome requires a team of specialists to provide lifelong care, including pediatrician, coordinates overall care and monitors development. Geneticist, confirms diagnosis and offers family counseling. Neurosurgeon, handles cranial surgery, if needed to relieve pressure on the brain. Craniofacial surgeon, or plastic surgeon, performs reconstructive surgeries on the face and skull. Orthopedic or hand surgeon, separates fused fingers and toes to improve function. Dentist and orthodontist, treat jaw alignment and dental crowding. Speech and occupational therapists, support communication and daily living skills. Treatment options. Treatment for Apert syndrome is individualized and usually involves several surgeries during childhood. Cranial surgery may be performed in infancy to allow the brain to grow properly and relieve pressure. Hand and foot surgeries typically begin in the first few years of life to improve dexterity and mobility. Therapies, speech, physical, and occupational therapy play vital roles in development. Orthodontic care is often needed for proper bite and speech. Supportive care is just as important. Children with Apert syndrome thrive best with love, early intervention, and a strong care team. Questions to ask your doctor. If your child is diagnosed or suspected of having Apert syndrome, here are key questions to ask your doctor. What genetic mutation is involved? What's the recommended timeline for surgery? Will my child need therapy or special education support? Which specialists should be part of our care team? Should we consider genetic counseling for future family planning? Living with Apert syndrome. With the right medical care, many children with Apert syndrome grow up to lead fulfilling lives. Advances in surgery and therapy have greatly improved outcomes over the years. Remember, early diagnosis and a committed team of caregivers and specialists can make a world of difference. Thanks for watching. If you found this video helpful, please like, subscribe, and share with others who may benefit. Have any questions or want to share your story to help others, please comment below. Don't forget to like, share, and subscribe for more helpful videos on health and wellness. Disclaimer: this video is for educational purposes only and does not replace medical advice. Always consult with a healthcare professional. Until next time, stay happy, be healthy, and stay informed.